Hello and welcome to Famedix Pharmacy Help Beat Diabetes Care Center. Today we are going to be talking type 1 diabetes. Type 1 diabetes. If you're a young adult recently diagnosed with type 1 diabetes, or you're a parent with a child or teenager recently diagnosed with type 1 diabetes, this video is for you. Type 1 diabetes is serious, but it is manageable. With the right knowledge and discipline, you can live a full, strong, productive life with type 1 diabetes. Coincidentally, last week, very rarely, it's not common, a young man walked into the pharmacy and asked to speak with a consultant pharmacist. He had been online and seen that diabetes care in the community is our mainstay at Famedix Pharmacy. He told us his story. A couple of weeks ago, while in school, a higher institution writing exams, he fainted. He had been having these symptoms, dizziness, sweating, for a couple of days. His roommates wondered what was happening. But when he fainted during the exams, they had to call his parents, who came to pick him up. A couple of days before that, he had gone to the health center and they had diagnosed malaria and typhoid. They treated him, placed him on drip, and he felt a little better. So he thought all was well. When he fainted during his exams, the parents had to come pick him up. They brought him to a lorry, took him to a good healthcare center where they continued with the typhoid treatment. But thank goodness they had a fantastic doctor, medical doctor, who thought otherwise and decided to test his blood sugar, where they found out that his blood sugar was off the roof. Having done a few tests, the doctors confirmed that this young man at 24 had type 1 diabetes. They had to place him on insulin. Insulin is the mainstay in the management of type 1 diabetes. Diabetic tablets have no use whatsoever. Type 1 diabetes is an autoimmune condition. Your immune system mistakenly destroys the insulin-producing cells in your pancreas. Insulin is a hormone that allows glucose, that is sugar, to enter your cells for energy. Without insulin, sugar builds up in your blood. This is not caused by eating too much sugar. It is not your fault, and it is not reversible, unfortunately, but it is controllable. And that is why you are placed on insulin. Since your body does not produce insulin any longer, you will need to be given insulin for your body to be able to control the blood sugars and utilize sugar from the blood. So, usually you're placed on two types of insulin. One is the long-acting insulin, which acts over 24 hours. For this young man, he was placed on Lantus, which is known as insulin glargine. Lantus is a long-acting insulin. It provides what we call basal insulin, background insulin that works slowly over 24 hours to keep your blood sugar stable between meals and overnight. You must take it at the same time every day, usually taken at night between 9 and 10 p.m., and exactly as prescribed by your doctors without skipping it. Insulin is now your lifeline. Respect it. You will also be placed on a short-acting insulin. Examples of short-acting insulin in the market are Novorapid or Actrapid. The use of the short-acting insulins are for meal times because after you've eaten, your blood glucose shoots up and the body cannot tolerate such high levels of insulin. So the short-acting insulins are to be used 20 to 25 or 30 minutes before each meal, before breakfast, before lunch, and before dinner. So they are only to be used before food, while the long-acting insulin is used once a day, called the basal insulin. So that controls your blood sugar throughout the day and night, even as you sleep. But just before a meal, you use the short-acting insulins so that your blood sugar doesn't shoot or spike too high. Secondly, blood sugar monitoring. You cannot manage what you do not measure. You cannot manage what you do not measure. You must check your blood sugar every morning. That is called the fasting blood sugar test. So every morning before breakfast, you must. Unlike type 2 diabetics who test their blood sugar once a day, 2 or 3 times a week, once a month, a type 1 diabetic must test his blood sugar every morning. He must test his blood sugar before meals, especially in the early phase while he's trying to get control and understand his body. He must test his blood sugar before exercise and also whenever you feel unwell. The reason for testing whenever you feel unwell is to know whether your blood sugar is too low or too high. That helps you determine what action you are to take. Target ranges for most adults. So while you test your blood sugar, you need to know what to aim for. Your fasting blood sugar before breakfast must be or should be between 4 and 7 millimoles per liter. Between 4 and 7. And 2 hours after meals, we want your blood sugar below 10. We want your blood sugar below 10 2 hours after meals. That means that first thing in the morning to periods after meals, your blood sugar must have dropped. So if you're using a short-acting insulin just before meals, an hour or two after meals, we want your blood sugar to have dropped below 10 millimoles per liter. And you must write down your readings so as to understand the patterns and to learn how to manage yourselves well. Low blood sugar. Low blood sugar is a big challenge for patients who use insulin. And low blood sugar is when your blood sugar test gives you a reading below 3.5. Usually we'll say below 3.9 to be safe, really. So anything between 3 and 3.9 is counted as low blood sugar. And low blood sugar is called hypoglycaemia. Hypoglycaemia. And is the most immediate risk for patients who are on insulin. Symptoms include sweating. So symptoms of low blood sugar include sweating, shaking, shivering, hunger, dizziness, and confusion. I'll go over that again. Symptoms of low blood sugar includes sweating, shaking, hunger, dizziness, and confusion. If your blood sugar is below 4, take fast sugar immediately. So as a type 1 diabetic, you ought to always have a supply of glucose on you. Get some glucose tablets from the pharmacy, or in the absence of that, you take a sugary drink immediately. These symptoms appear and you've tested and you have a blood sugar below 4. And you must recheck your blood sugar every 15 minutes until your blood sugar goes into the normal range. Always carry glucose with you. Never argue with low sugar. Treat it immediately. So as soon as you observe those symptoms or you get a reading below 4, take your glucose tablets or a sugary drink immediately. It's very, very important. Food and lifestyle. You do not need to starve. Remember, you do not need to starve, but you must be disciplined. You must eat regular meals. You must eat controlled portions of carbohydrates, whether rice, yam, gari, and fufu. Controlled portions, little portions. You don't eat carbohydrates in large quantities. You must avoid sugary drinks. Sugary drinks are only to be used in the emergency case of low blood sugar where you have no glucose tablets on you. So you must avoid sugary drinks. You must include vegetables and proteins in your regular diet, and do not skip meals while on insulin. Remember, you take your basal insulin, long-acting insulin, once a day. So you have some insulin in your body throughout the day over a period of 24 hours. So you cannot really afford to skip meals. If you skip meals, your blood sugar may well drop below the target range. Exercise is good, but check your sugar before every intense activity. So before deciding to play football or go on a jog or go on a run or do any intense activity, check your blood sugar. If your blood sugar is below range, below 4, then you must eat something and check again. Your blood sugar must be above or within normal range before you take part in any form of exercise whatsoever. Danger signs that you must not ignore. Danger signs that you must not ignore. Seek urgent medical attention if you experience any of this. Persistent vomiting, persistent vomiting, very high blood sugar. So you test your blood sugar and you get readings of 20 millimoles per liter and above. That is high. You must seek medical attention immediately. Severe weakness. You feel totally tired and exhausted. You cannot even lift your hands. Deep breathing. You find that you're having to breathe deeply. You're breathing deeply. That is a danger sign. Fruity smell in your breath. So when you cover your hands over your mouth and you blow out air, your breath smells fruity, like you've just eaten some fruits or some sweet thing. That is a danger sign. These may be signs of diabetic ketoacidosis. Diabetic ketoacidosis, this means that your blood sugar has been on the very high side over a period of time. Type 1 diabetics or type 1 diabetes demands structure. Demands structure. It's a different life for you immediately type 1 diabetics is diagnosed. It will require maturity, consistency, and responsibility. You immediately grow up because you need to take responsibility for your body, for your life. But it does not cancel your destiny. Remember that. It doesn't mean that you cannot do the things that you wish to do. We have type 1 diabetics competing in the Olympics. So the fact that you've been diagnosed with diabetes type 1 does not mean that life has come to a stop. At Famedix Pharmacy, we believe if you control your diabetes daily, it will not control your future. If you were recently diagnosed and need guidance, visit us at Help with Diabetes Care Center. Of course, if you do not live in Ilorin, you do not need to come to us. Visit your medical facility and ask to speak with a diabetic specialist. We are here to walk this journey with you. Stay informed, stay disciplined, and stay strong.